Shakira, it's already 2 p.m. Can we slow down the music? Yeah. All right. Okay. I think we are having quite a good crowd, and we have people joining in. Dr. Lanre, can you hear me?
Yes, I can hear you. Thanks. I'm over
All
here.
right. Okay, so we start now. A very good afternoon, everyone. Hope I'm loud and clear. And welcome to our webinar series hosted by the 24th Asian Congress on Occupational Health 2026 that will be held in August in Kuching, Sarawak, organized by Academy of Occupational and Environmental Medicine Malaysia. Welcome everyone to our webinar session today titled Leadership, the Missing Link in Occupational Health Effectiveness. Together with us, we have Dr. Lanre Ogunyemi, all the way from United Kingdom. I think Dr. Lanre is a very, very familiar name to all of us in the world of occupational health, occupational medicine. Allow me the honor to introduce Dr. Lanre to everyone here today. So Dr. Lanre, welcome to our webinar session today. Dr. Lanre is currently serving as the Medical Director of Trinity Occupational and Public Health Solutions Limited, which is a leading occupational health provider in the United Kingdom, where Dr. Lanre is currently overseeing occupational health services across diverse industries and leads faculty-accredited occupational medicine training programs. Dr. Lanre has been in the field for very long, and he actually trained as a surgeon before transitioning to the field of occupational medicine. And he is widely recognized for his vast contribution in the field of occupational health education globally, and also in setting up professional standards. He is the academic registrar or chief examiner of the Faculty of Occupational Medicine of the Royal College of Physicians of Ireland, and and also previously served as the chief examiner at the UK Faculty of Occupational Medicine. He's also a visiting lecturer at numerous occupational medicine training faculties and programs. Dr. Lanre is also the immediate past president of the Society of Occupational Medicine, United Kingdom, and also founding chair of the SOM Leadership Academy. He is currently also playing the active role with the International Commission on Occupational Health, ACOH, and have extended his support to our upcoming ACOH 2026. And that is a very quick introduction. The list goes on, but I will stop here in view of time. And can we go to the next slide now, Shakira? All right, so before we go into the real session, allow me to mention a few of the house rules for the webinar session today. So this is a live event session, which means that we will not be able to take questions directly from the audience. But however, please keep your questions coming in through the chat room. And I will be the mediator. I will take the questions and get Dr. Lanre to provide his comments or answers in with the time available, or we may discuss that later, and of course during the conference itself in Sarawak. All right, so please stay focused during the session and be professional, be respectful at all times, and do not share any confidential or private information, particularly about your workplace, in the chat room. And with permission, we will be recording this session for later, and also it will be available in the ACOH website. However, no handouts will be provided. And for Malaysian audience, please stay until the very end, because we will be showing you the QR code for you to register and also to collect your MMA CPD points. So that will be towards the end of the session. All right, can we go to the next one? Shakira, allow me to quickly show you the agenda. So I am your host for today. I forgot to introduce myself earlier. I'm Dr. Jasima. I'm one of the occupational health advisors with Petronas. I'm also a trained public health medicine specialist. So we will be starting the session very shortly, and after Dr. Lanre's presentation, we will go into the Q&A session. As I mentioned, I'll be moderating, and followed with a quick promotion about our upcoming ACOH 2026 in Sarawak. And following that, we will end the session by projecting the QR code for your CPD registration, and also if you're interested for the ACOH registration. All right, so it's already 2:04 p.m. and without further delay, I will pass over the session to Dr. Lanre with his presentation titled Leadership, the Missing Link in Occupational Health Effectiveness. Over to you, Dr. Lanre.
Thank you very much, Jasima. I'm just going to share my slides now. So hold your breaths, everyone, and let's make sure this works.
So meanwhile, I would like to mention that thank you so much to our Malaysian audience for joining, because it's a public health, what's this? Public holiday today, public holiday today here, over here. So we are having a replacement holiday, and thanks to everyone who, being with us despite being off day. All right, Dr. Lanre.
Well, thank you all so much for joining, and good afternoon to everyone in Malaysia. Good morning or good evening to other international colleagues that might be joining. Thanks for the kind introductions and for the overview of my involvement. And this is is not all work. Sometimes there's a bit of fun. And last year I did Kilimanjaro, and that's just an image of me at the base of Kilimanjaro at the base camp before the climb. So on to the substance of the talk. Before we move into the talk proper, I would like us to pause and briefly reflect on our organizational experience. A recurring theme internationally is that occupational health often possesses substantial technical expertise, but very variable strategic influence. So we're going to have a lot of polls here because I want to prompt reflection. But the first question I have is designed to understand how occupational health is positioned within your own organizations and systems. So I'll be curious as to how people respond to this. We have a slight technical difficulty with the polling, and it's probably going to be easiest if you just put A, B, C, D, E in the chat with regards to the next poll. So. I'd be grateful if you just, I cannot see the chart, so if...
Okay. Shakira, can you post the poll here at the chat? Yeah, it's up, Dr. Lanre, yes.
Okay, thanks. So I'd be interested in how people find that occupational health, their own occupational health access to senior organizational leadership in their setting. Do you have access to direct senior organizational leadership? I find it interesting that many systems are technically strong, but they're not always core to the decision making within the senior leadership team. So it's often structurally peripheral. And this distinction matters because occupational health will not be able to influence organizational priorities effectively if it sits outside of the strategic decision-making structures. Now,
mostly has answered yes routinely.
Okay, so it's okay to move on now.
Can doctor. Yeah,
I'm just going to move on. Okay, thanks. So I'd like to begin with a paradox. Occupational health has never had a stronger technical foundation than it does today. The science has been improving. We are setting higher standards. The training has been improving. There's much more awareness of occupational health, and there is improving technology. However, when we look around the world, the occupational health outcomes remains deeply uneven. We have ILO figures that indicate 3 million work-related deaths annually, and more than 100 times that in terms of work-related injuries annually. So we have access to occupational health services remaining very inconsistent. Here in the UK, only about 50% of workers have access to occupational health, and it's a lot poorer in other countries. So implementation gaps remain very substantial. This next question is to prompt your thinking about, okay, why is this happening? What limits occupational health impact in your own setting? Um, is it workforce limitations? Is it leadership influence? Is there an inherent problem with the way policies are implemented? Is it a question of employer engagement? And is it a question of technical expertise? I'd be curious about what your experience is, and if you don't mind popping that in the chat as well.
Yeah, Shakira, can you post the question, the second poll now? And for those who are not able to answer, you can post the answer as A, B, C, D, or E. Can we have the second poll up, Shakira?
Hi, Doctor. And for the second question, I suggest like we just let them write their answer, whether A, B, C, D, or E.
Okay.
In the
All
chat.
right.
Okay, yeah, that's fine.
Yeah. All right. Okay.
I cannot see the chat because it's a full
yeah.
screen. So
I will summarize for you. So, audience, please post your answers as one of the options here, A, B, C, D, or E, and we will summarize it. For the first one, Doctor, majority answered A.
okay.
Routinely.
Thank you.
So for the
Thank
second,
you.
yeah. For now, it's coming B mostly.
Okay.
Yeah, and one C and one D.
Now, usually for these things, there isn't really a single correct answer, and it will vary on in your setting. So, um, but my talk and my argument is really about being able to tackle one of those limitations, and I hope over the next few slides to take you on a journey about how that matters and how perhaps one can tackle that particular limitation. So first, a reminder of why occupational health matters. We now have a lot of evidence in terms of systematic reviews, meta-analysis, implementation research, observational studies, and all this repeatedly indicate that occupational health interventions can improve worker health in terms of whether it's safety outcomes, in terms of well-being, whichever way you measure that. Also in terms of productivity, sickness absence, and developing a sustainable workforce. The important thing is that this evidence increasingly also suggests that leadership influences whether these interventions are successfully implemented and sustained. The evidence also suggests that leadership appears to shape organizational culture, participation in these programs, the level of trust that people have, the quality of the implementation, as well as psychological safety, and whether worker health is prioritized or not. All this is important because it influences how we think about occupational health effectiveness. The question is no longer only what interventions work, but the question becomes under what leadership and organizational conditions do these interventions succeed, or are they more likely to succeed? Now, it is similar in terms of leadership within occupational health. We have a lot of evidence that shows that this leadership is a critical driver for effective occupational health. And the evidence points to leadership being an enabling system determinant that drives conditions, behaviors, and systems that improve occupational health outcomes for workers, organizations, and communities. And we, as occupational health clinicians, we have to then adopt those leadership ethos so that the others within the organization, particularly the senior leadership team, also embrace that agenda for improving workers' health. My main proposition, and this slide is perhaps the main encapsulation of what I'm proposing, is that the leadership does not influence occupational health outcomes in a simplistic, direct way, but rather it helps shape the conditions under which occupational health systems operate. So the leadership influences whether occupational health is prioritized. It influences whether adequate resources are provided. It also influences whether workers then trust the systems that deliver those outcomes in terms of worker health. It helps influence whether psychological safety exists and whether implementation occurs consistently. All these factors influence people's participation within programs, the quality of any occupational health programs, the engagement that the workforce has, and the success that you have at improving workers' well-being, injury prevention, and overall occupational health outcomes. So our systems often fail or succeed due to the leadership ethos around them. In other words, technical expertise alone is insufficient without supportive leadership structures and organizational culture. And once we have the initial leadership commitment, and it is sustained through the organization, then one can expect that it can reasonably lead to good business and social and social impact. To put it in another way, upstream, we want leadership commitment and strategic position. And then downstream, we want improved occupational health outcomes. And the idea is that if we can create the situation and the milieu and the culture to help leadership thrive within occupational health upstream, then we're more likely to then achieve these occupational health outcomes that we want in terms of well-being and productivity. Next, I'm going to give just two short examples or stories to illustrate the leadership agenda that I have here. First, when we look at Finland, earlier I mentioned about the global paradox in terms of our expertise increasing within occupational health, but the outcomes reducing. In a lot of the Nordic countries, they have been a lot more strategic in terms of how occupational health is positioned within their systems, and their systems appear consistently stronger. I've just selected Finland. This is true of a number of the other Nordic countries. What is striking is that it's not simply technical expertise that they have, but they also have integrated occupational health systems. So the occupational health becomes embedded within their policy, their workforce systems, their public health priorities, and their national priorities. Now, this only occurs because they have had the required sustained leadership. And for them, occupational health coverage is mandatory, and this has translated into high workforce coverage and indeed improved well-being for their own worker health, their workforce. The next example I'm going to give is one which is quite familiar. COVID-19 for all of us was a bit of a natural experiment. And during the pandemic, in some organizations, occupational health was forced to sit within leadership structures. And what we saw then was that the occupational health professionals, that were involved directly, they influenced workforce planning, they influenced risk assessment, the continuity strategy within the organizations, and also the return to work process. This helped those organizations respond more coherently. In places where occupational health remained peripheral, the observation would have been that they would not have had as brisk or as good a response. The difference here was often not technical knowledge, the difference was access to influence. Even though COVID is now some ways in the past, during the COVID period and the immediate post COVID period, most people anecdotally saw increased influence in occupational health because the organizations saw the benefit of occupational health involvement in strategic decisions immediately. Some of that profile gain that we had is now in the rearview mirror. Maybe even most of it, as for a lot of organizations, has come back to status quo as occupational health being less central into their leadership structure. Um, so, in summary, we are strongest when occupational health systems are integrated into leadership policy and workforce strategy, rather than when it is positioned at the periphery of the organization. So, COVID-19 demonstrated that organizations with occupational health embedded in their leadership structures adapted more effectively. And the critical difference internationally is often not technical expertise, but access to influence and strategic integration. So how are things now? The current reality is that leadership within occupational health remains very, very variable. Uh, One of the most interesting findings from undertaking reviews of curriculum is that leadership development is inconsistent internationally. In many systems, we have leadership being described, but it's often generic or implicit. Sometimes it is assumed, maybe even most times it is assumed to emerge automatically as you get more senior. But occupational health leadership is quite distinctive. It requires us to balance advocating for the worker with the employer's priorities. It requires us to balance advocating for the patient with ethical constraints, with knowledge of the law, and also with a focus on prevention as well as organizational strategy. So we tend to have a unique balance of drivers that is not always present in other leadership development systems or leadership training systems. So we have to ask ourselves honestly, are we producing technically competent experts? Are we intentionally developing future occupational health leaders? My argument is that a lot of current curricula do not do that, and we need to change and be very intentional about how we develop occupational health leaders that are able to cater to the emerging demands on workers' health now and for the future. So this is just putting it in another way. The traditional occupational health training profile, focuses on getting you the clinical science, the law, the toxicology. The influence and the strategy bit is often a few lectures and perhaps usually driven from business world or broad leadership studies. But in our world, occupational health is distinctly complex and requires bridging clinical health and commercial reality. And what we propose is that we need to start developing leadership skills that are specific for occupational health and which borrow from what has been known generally about leadership and then is bespoke or made to fit occupational health a lot more. So we need to have cross-boundary translation. We need to have commercial acumen. We should be able to advocate well for the workers, and we should be able to navigate the ethics of practice in whatever society we might find ourselves. So we need to ask ourselves honestly about how occupational health, how we're developing future occupational health leaders, or are we assuming that it emerges automatically through seniority and experience alone? In this next poll, what I'm curious about is what I've made a lot of assertions, but I'm interested in people's experience in terms of leadership teaching during their own occupational health training or their occupational health experience so far.
Shakira, can we have this poll up?
So this is intentionally reflective. And I don't want you to think about generic management thinking. I want you to think specifically about, what you have been thought about influence, about strategic leadership, about systems thinking, about change within organizations, about collaboration, all those things in terms which are key components of leadership.
Dr. Lanre, if I can summarize for you, we are getting a mix of answers. We have E's, we have C's, D's. It's actually a pretty blended mix. Some are saying there's one A, a few B's, a few C's, and a few D's.
Okay, thanks. In my experience, the A's often come from a lot of international, multinational companies who already have a strong work health focus, and then who invest time in teaching all their managers a lot more about leadership. Other organizations may be less focused on that, but it's always interesting, this mix, when I try and find out. But what comes to me from this is that the majority of people do not have formal occupational teaching, and when they offer formal leadership training during the occupational health, and sometimes when people have it, it's often a series of lectures rather than something that's experiential and reflective or ongoing. We need strong, I feel, leadership focus within training, and we need it to be more experiential as well. So I'm going to just tell you a little bit about the SOM Leadership Academy, which, as Jasima mentioned earlier, we started just over a year ago within the Society of Occupational Medicine. And this was mainly driven by a desire to try and address this leadership gap that we had identified. And this is the home for leadership training within our community back in the UK. The focus is also making sure that it is multidisciplinary, serves everyone with occupational health, and also supports leadership across different career stages. In trying to do it, we're looking at not just developing a single tool or resources, but also trying to make sure that we may be signposting people to existing resources, but developing resources which are focused on purely occupational health. And part of it is looking to make sure experiential components in our development, in our offering rather. So the leadership competency framework is our first concrete output, and I'm going to talk a little bit more about that. But also, we're doing things like having a peer forum, having coaching register so that people can have some type of transformational coaching to help develop the behavioral skills that might be identified as useful for them to develop, maybe on reflection through using the competency framework. And we're looking at things like also developing lecture offers. We're linked to, we have a mentoring offer as well. So we're trying to make sure that there are different avenues to be able to develop people's leadership skills is not a one size fits all, but an approach to have an ecosystem whereby different leaders can have something which helps improve their leadership skill, at least concretely and substantially, and for some people, transformationally. So, a little bit about the competency framework. This was founded from research looking at several occupational health leaders and what was required for occupational health leadership. And it's divided into 4 domains. First, looking at the core, which is the central domain, which is really self, and which is similar to a lot of other leadership frameworks. First, understanding yourself, and then from that, looking at the second domain, the people and your practice, and then the third domain, leading the organization, and finally leading the profession. But the idea is that we identify the particular things within occupational health leadership that are likely to make you a more successful occupational health leader. And some of these things are unique to occupational health. I kind of alluded to it previously in terms of the need for commercial awareness. One of the things that came strongly as well from the leadership competency framework was a business acumen. So I definitely recommend that you have a look at our occupational health leadership competencies framework and perhaps reflect on it on how your own leadership journey has been and what sort of which ones of the domains or competencies we've identified resonate mostly with you. Is not intended to be a very an exhaustive analysis of all competencies, but focusing on the main ones that we think are likely to be transformational. Now, there's a QR code on there which you're welcome to scan that takes you straight to the framework. It's a free available resource from SOM, and there's through the SOM website, even though I've not published a QR code for that, you can we welcome feedback and surveys and feedback on how you find the leadership framework.
Dr. Lanre, I have posted in the chat also the QR code.
Thank you very much. Thanks. A key thing which I like to mention here, because I'm a physician, and sometimes when you're talking, people focus on the physician community, but the reality is occupational health is multi-professional, and any thinking about leadership has to have that level of inclusivity. If you're setting up your own leadership structures and training, it has to be inherently collaborative and multi-professional, involving all the various participants in our occupational health team, all the people with a vested interest in improving workers' health, whether physiotherapists, occupational therapists, hygienists, technicians, and I've tried to include that as much as possible in this image. So one of the reasons that I'm talking about this as well is that the sort of developing systems whereby occupational health and worker health is currently being made concrete with regards to training, accreditation, and systems. It's important for there to be some thinking about how you embed this type of leadership ethos alongside developing the technical capabilities that are required for your occupational health professionals. I think for Malaysia and the wider region, who are earlier on in that journey, this is an opportunity to build differently. For many mature occupational health systems, they have developed and focused on just technical capability first, and then the leadership integration has evolved later and sometimes inconsistently. For rapidly developing systems, this is an opportunity to be intentional in how you design occupational health for influence from the beginning. So that includes being able to ensure that there is multi-professional collaboration attitude within how things are developed. It helps to also make sure that there are concrete ways of making sure that leadership behaviors, leadership skills are developed, whether it's educational curriculum or any form of experiential learning, that those leadership elements are integrated within your systems. Good. It should also be integrated in your workforce strategy, and it should align with whatever well-being and sustainability agendas are in that system. So I see it as for rapidly developing systems, I see it as an opportunity, not simply to expand access to worker health services, but an opportunity to position occupational health strategically within the future of work, the workforce resilience, and also the organizational sustainability. So I think having good leadership integration is going to be central to being able to achieve good health outcomes for workers going forward. I mean, the important thing as well to mention here is that when one looks across the world, practically all systems have too few experts, too few doctors, and the way to make sure that those few technical experts can make an impact is to develop these leadership skills so that their ability to influence is high. And this is stating it in another way. When one is then looking at what practical actions you can take to bridge the gap for educational systems, my view is that we need to make sure that we're not just giving passive lectures, but there are components that allow experiential leadership training, supervised practice, and that the training systems have integrated mentorship, workplace projects, supervised experience, implementation, learning as examples of how to develop true leadership skills and behaviors within the occupational professionals. Also within the organization, the aim would be to ensure that occupational health is visible and it has influence and is integrated. And all this quite often means that the occupational health leaders and professionals within those organizations have to acquire the leadership skills to be able to help achieve those changes in terms of the visibility and influence in particular. So this next poll is to just test your, check your thinking about what you consider would be the most challenging occupational health issues over the next few years. So it is a forward-looking question, and I'm interested in what you feel is most significant in your own sector or your own environment at the moment.
Right, audience, you can write your answers in the column, the chat column. So what can be the future challenge that will stand for which leadership over the next 10 years?
Yeah.
So you can choose more than one, right, Dr. Lanre?
Yes, you can choose more than one. Yeah. I mean, there isn't a single correct answer here. In fact, one of the important points is that this challenge is often interconnected. AI may change job design and skill requirements. Climate change may affect heat exposure and outdoor work and so on. Mental health and psychosocial risk may be shaped by things like workload, insecurity, and organizational culture. So it's often interconnected, but the purpose is not simply to rank the future risks, but to help illustrate how the future of occupational health will require systems thinking, and that these are issues that are often not solved by technical knowledge alone, but will often require us to be able to influence organizations, work across different disciplines, look at different evidence, deal with uncertainty, support policy, and help the leaders in organizations and society to make better decisions. So, as the results coming in the chat, it will be interesting to see what people think on which challenge you selected, and I'll be curious as to in your what you think yourself, in terms of your reflections, whether you think occupational health is currently positioned strongly enough to influence how your own organization or systems responds to the challenge you have highlighted.
Right, Dr. Lanre, we have mostly answering A and B, mental health, AI, and changing work. And we're also seeing a good mix where audience have chosen a mix of ABC or ABF. And some have also chosen all. So
Okay, yeah.
yeah.
Yeah, that's interesting. I mean, if we did this in the UK about 15 years ago, workforce aging would probably have been the main thing that people were seeing. It was all the rage, but obviously the picture has changed quite a bit in recent years as well. Um, so, but what it illustrates is that this is quite complex. We have a complex system, and the complexity requires system leadership. So, I think that the future of occupational health, it will become more complex, not less complex. So we're entering a period where occupational health professionals must engage with all these risks, whether it's the climate-related work risks, the technological disruption, the workforce sustainability, or the psychosocial risks, or just our changing demographics. These are not problems that are going to be solved just through technical expertise. They require deep systems leadership. And so I would like to end with a very simple thought. Occupational health has already built strong technical foundations. Our next challenge may not be simply to develop more expertise. Our challenge may be developing more influence, because ultimately we will not achieve impact simply by knowing more. We will achieve impact by leading more. Thank you all.
All right. So thank you so much, Dr. Lanre, for the very, very wonderful presentation session. I was so carried away that I forgot the session has actually, come to an end. It was so inspiring. Listen to you. You have summarized very well regarding, the priorities, how occupational health leadership has to be systematically integrated within an organization, how countries, for example, the Nordic countries, they are prioritizing occupational health within their national policies. In my personal experience, when I was doing a occupational health disease burden study, a lot of my reference were towards how the Nordic countries were doing it, because it's a very, very long-standing history over there. All right, that's very interesting. But one thing that,
Thank you.
and one thing that really interested me was are we intentionally producing OH leaders? Are our system actually facilitating for that sort of, training and also policies to have that intention to produce occupational health leaders? Those are the kind of things that really inspired me. So, dear audience, we can start taking your questions. I wanted to ask some, but I will hold that for later. I will prioritize the audience. So we have Nadia Saleh from Brunei. Her question is, Dr. Lanre, to you. Could you elaborate and share more on what you meant by system leadership when addressing complexity at the workplace? If I can,
what I mean and what I really want to focus on is the way that our educational systems approach leadership within occupational health. I would like it to be a lot more integral. So I would like to see, even though it appears in curriculum, I would like to see leadership being a core competency of all curriculums, and for there to be detailed elements of all those curriculum, as in how do you understand systems, how do you influence systems, how do you persuade, what sort of language do you need to learn, and for all that detail to be present within the educational systems in occupational health. We should not abandon our traditional things in terms of understanding the workplace, understanding work-related diseases, but being able to step into an organization and then influence the senior leadership team should be something that should not be left to just exceptional individuals. It should be part of our training, how we get up, how we, as we become better clinicians. The idea being leadership, it's not a random thing. It should be something that we can train our clinicians to be. So that's what I mean. And the reason I say in terms of addressing complexity within the workplace is because it's not just about technical understanding, it's also about balancing all the various demands on us. And these are things which, as you learn the better leadership skills, you're then able to address those. So hopefully that helps.
Yeah, thank you. Thank you for the question, Nadia, and thank you for your response for that, Dr. Landry. Moving next to, there's a question by Dr. Vinay from India. Yeah,
Okay.
could you please elaborate, Dr. Landry, on the commercial acumen aspect of leadership? Also, could you please tell us, that's a bit of second part to it. So if I can repeat, could you please elaborate on the commercial acumen aspect of leadership? Also, could you please tell us more about the SOM leadership course?
Firstly, in terms of the commercial, or I think we call it business acumen within the framework. One of the things which I think personally became very apparent early on in my occupational health journey was that you needed to have some commercial awareness to operate within the occupational health field. In terms of speaking to businesses, you cannot just talk the language of healthcare alone. You have to have the language of understanding what the impact of your decisions and advice on the organizations might mean to their bottom line, because that's how they then listen to you. And the when we did our survey that informed the competency framework, it was apparent that a lot of the occupational health leaders had also had a similar experience, that you need that commercial awareness, that business acumen, that ability to understand the commercial needs of a business as part of your toolbox to become an effective occupational health leader. So that's what we mean by the commercial acumen and the business awareness. And if you don't have that, you're likely to be less persuasive as an occupational health leader. It doesn't mean that you are now operating from just a commercial bias. It's more a question of understanding where the people you're trying to influence are coming from, rather than so that you're not just approaching it from a healthcare provider perspective alone. So the second bit in terms of the leadership course, probably better to frame it this way: is the leadership academy is, rather than being a course, is more a home for leadership training. So we have conferences, we have recorded webinars, we have different resources in terms of libraries of leadership material. We also have coaching register for people who have identified behaviors they want to improve, and we have the competency framework. One of the recent things we've also had developed is an early leaders forum, which then meets regularly for leaders to then develop their own, the early leaders to have reflective meetings on their own leadership journey, and for them to have collective discussions. There isn't a one solution fits all for this, and I think we have to have a broad college of leadership educational resources and leadership development resources. But this has to be something which is very central, I think, to any occupational health training or educational curriculum.
So it's not like one size that fits all. It has to be customized towards what's the need of that country or the organization. Thank you, Dr. Lanre. And we have more questions coming actually. So the next one is from Dr. Rosli from Malaysia. The question is, what is the role from ILO, International Labour Organization, in order to ensure the coverage of occupational health in leadership culture based on your research? I guess it's the top down, what's the drive from top down? Yeah.
I think from what I've read, certainly both the ILO and the WHO, there is strong advocacy for leadership in all of their publications. I can't speak to any executive role that they might have other than this advocacy role, if that makes sense.
Okay, advocacy. Thank you, Dr. Lanre. And the next one is from Bashir Taj. The question is, what is the impact of UN Sustainable Development Goal and relevant local regulatory requirements in occupational and environmental medicine practice as it is varied? Would just leadership be enough?
Yes, I think, I'm not sure if that came through quite enough in my talk. Whilst I'm focusing on leadership, in terms of making a difference, it is one of the issues. It's not the only issue. As you say, regulatory requirements are key. And indeed, in my experience, they're often the most persuasive issues. I come from the UK, where the HSC is probably one of the biggest tools of effecting change in terms of workers' health. I tend to look at it, I was taught that there are kind of three things that you use when you're trying to persuade people or senior members organizations. Three main arguments. One is the legal argument, then there's the moral argument, and then the sort of commercial argument. But I think in order to be effective with any of this, the leadership skills are a broad church that you can use to be able to make sure that, one, you are even in a place in the room where these discussions are happening. So key thing, it's not a one solution, but it's, I think, an integral part of the various solutions that you might need to deploy in order to be able to help improve workers' health. And of course, your priorities might be different depending on which environment that you're working. Some environments have strong regulations, some have perhaps stronger moral drivers, and some might have stronger commercial drivers. But with you will then have the skill to balance exactly where what might need to be the priorities there.
All right.
Hopefully that answers your question, Dr. Bashir.
Yeah, Dr. Bashir, we hope that it answers your question. So basically, it's about understanding the priority and striking a balance. And if I can add, Dr. Lanre, we do face situations where certain, when you're managing like multinational companies, certain countries do not allow access to, certain health-based data. So there can be limitation in for occupational leaders, especially in summarizing what is the health issue, what is the occupational health issue, how the situation is globally. So between the variation between the country data itself can be quite challenging because of the local regulatory requirements. And to sum up and come up with the next step of action. Right. So we have 7 more minutes, and I will take the last question from our very own Dr. Abu Hassan Samad, our President of Academy of Occupational and Environmental Medicine Malaysia. So Dr. Abu's question is, one of the main issue is how do we put across our messages? I think it's more towards a comment first and then the question. Most of the time we fail because we are too technical, then we communicate when we communicate with others. How can we address this issue during the undergraduate and postgraduate training?
I'm going to thanks Dr. Abu for that. I think it's a very insightful comment in terms of the issues that we're facing here, and I'm going to give what is really my own view as opposed to sort of the Leadership Academy view. I do agree that we need to look at how we develop the language to communicate better. And I think in terms of leadership, this communication skill is also core. We tend to have some people who are naturally good communicators and some people who are not quite as good. And sometimes people assume that that is something which is a permanent state. Whereas you have to get people to understand as well that you can learn how to communicate better and you can learn how to communicate in a way that matches your audience. Now, in terms of the second part of the question, in undergraduate and postgraduate training, I'll just focus first on postgraduate training because that's what I'm more familiar with. I think our curriculums are often very loosely framed in terms of leadership training, and I think they need to get a lot more reflective and a lot more experiential in terms of leadership training. An example is in the UK curriculum, there are outcomes you expected, which sometimes will be ticked off if you just attend a weekend course on management and leadership. Now, I don't think that's enough. It has to be something whereby it's ticked off when you have looked at, okay, your different abilities to influence the systems, organizations, and thinking as well. And then you have a bespoke thing suited to yourself, whereby if you need to go and have discussions with several leaders, if you need to have a coaching plan that helps you develop the specific behaviors that you need in order to make impact, that is actually part of your own development. And at the end of it, you can be confident that yes, you have developed the skills that are necessary for an occupational health leader. I could give you a sort of long answer because I'm very passionate about this, but I'll stop there and hope that that gives an insight to my thinking. But thank you, Dr. Abu, for that.
Thank you, Dr. Lanre. I believe the more of the answers we can gain through the Leadership Academy, right? The resources are there, the framework is there for reference. Maybe we can pick a bit more on that. And I have one quick question following up from Dr. Abu's question. Postgraduate training, and then we enter the industry, and or we become the service provider for the industry, or we become part of the organization. It can be large, it can be medium, it can be small. But once we are in, based on whatever you have presented, I am very curious about the how part about effectively convincing the leaders, the top management who are not within the health sector. They are beyond that, the management side and all that. Often we give them the generic, it's about the well-being of people, healthy workforce, if they contribute back to the productivity and all that. But how do we convince the leadership? How do we put up a very nice occupational health framework so that it can become a continuity? Training will not be effective. It's not being given a room to be practiced when one is in an organization. Yeah, Dr. Lanre.
Yes, I think sort of influencing the senior leadership team is a challenge, and it's one of the things that I want to expand on within the Leadership Academy and outside the Leadership Academy as well. And there are several ways of perhaps trying to do that. If I borrow from some of the perhaps well-recognized leaders within the business world, and some of the things they might say in terms of how they've done that. The At our last leadership conference, for example, Richard Heron was talking precisely about that particular journey, and how using data within the organization that belongs to the organization as a means of then being able to influence the organization to be able to then listen to you and to have change as one of the techniques that can sometimes be effective. But what I'd like to point out is that that is the aim of the leadership journey, as in getting better to be able to influence this. And there's several ways in which you might then be able to achieve that, but they're not things that will happen by accident. They'd be intentional. One of this is the data example that I've mentioned. Another is perhaps stories. That then help persuade the organization about the wisdom of being able to do something. From a personal level, I remember having when I was introducing screening for obstructive sleep apnea for some a rail company that I was looking at. This was something which nobody else was doing, but because I had been to a conference where they had these excellent stories, having a meeting with the senior leadership team, in which there was a very persuasive video, which you could see how people's, somebody snoring, having the somnogram, and the effect it was having on the heart, and also the mortality statistics. All that was very persuasive because it became very immediate to them rather than something abstract and technical. They saw the person gasping. And it was in a way which they could understand. So they signed up to it, and then which then meant that the organization could adopt the screening program. So you have to use what works for your environment, which means you have to understand the environment. But part of that is are some of the things that we help, we intend to teach within the Leadership Academy, and some of them are very bespoke for our own occupational health community, but there is too little of them at the moment. It's part of my argument, and we need to be intentional in terms of developing the skills and making them more accessible. Apologies, a rather long
It's very much
response to it, but
required.
hopefully,
I think I asked the right question. What is next beyond the
yeah.
postgraduate training, and what happens when somebody is already in the working world? In fact, until today, Dr. Lanre, in my annual performance review, I still write the leadership part as one of the challenges that I want to work on and improve, because I feel there's more to be done to convince the management when we want to implement good occupational health programs or have a great framework. Then we need to address where are we as an occupational health practitioner beyond the technical aspect, beyond the clinical aspect, where are we at the leadership? Address the missing link rightly. So it's already 3:01 here in Malaysia. We are 1 minute exceeding the time. So thank you so much, Dr. Lanre. I will stop with the questions here. And it was extremely valuable insights that you have shared with us today. We have more to learn, and we hope to meet you in Sarawak in August later for the conference to learn more.
Sorry to jump in. I'm very much looking forward to that, and I hope
Yes.
that some of my Irish colleagues and will come with me to that. So yeah, looking forward to that. Thank you.
Fantastic. We have so much to learn from you, Dr. Lanre. So thank you once again. Please be with us as I'm wrapping up the session. Dear audience, our conference is the 24th Asian Congress on Occupational Health 2026. It's going to happen very close. We are 9 weeks away. It's going to be in Borneo Convention Center, Kuching. The QR code is here. And we will be sharing the website link, and it's already shown on the page as well on the screen now. So this is our website. All you have to do is just type ACOH 2026 in your search engine, or scan the QR code shown on the screen here to register for the conference. Registration is still open. And for Malaysian audience, the conference is HRDC claimable. So there's added benefits. We are having technical tours and we have pre-congress workshops, gala dinner, so many other events lined up. All the details are available in our website. Next one, Shakira. All right, so we have some additional reasons for you to join the conference for our international audience. We have flight discounts made available for Malaysian Airlines, and we also have our local carrier, Firefly, also offering a discount up to 15%. And we have another one more advantage over here for everyone. If you're planning to bring your family members, your spouse, your grown-up children, or your partner, or any of your close members or family members who are interested to join us, they can join the conference for Malaysian Ringgit 150 with certain privileges being provided. They may not be able to attend the main conference, but they will be able to attend the launch, the exhibition, receive the lanyard. So this is something new that we are introducing. Often people, bring family and all for conference, for the tour and all, but they don't get to experience your professional, success or contribution in such a huge event. So this is the opportunity. It will be something really unique that we are offering for ACOH 2026. And also for those who have submitted abstract, thank you very much. We will have the opportunity to publish in Malaysia Medical Journal. If your Medical Journal of Malaysia, if your paper has been accepted and there's attractive prize money waiting, we have also put up a PowerPoint template in our website. If you're planning to attend the conference, this will be up by next week. You can project that or publish that on your social media page to proudly show off that you're speaking or you're attending the conference. All right. Next one, I think we are towards the end where we also have we have a few more webinars being lined up. The next one will be in a week's time. Title Occupational Health Physician and Migrant Workers Health and Safety. We will be emailing to all of you the details very soon. Next one. Right, so we are towards the end. For Malaysian audience, this is the QR code. Do not scan through your MMA app. Just scan using your camera or QR code app. Scan on this QR code shown here and register your details. We, the Secretariat, will help to submit manually to MMA so that the CPD points will be reflected in your MMA CPD record. All right, so that's it. That's all for today. Thank you so much, Dr. Lanre, for your time. And I'm really, really excited to meet you in person in Sarawak. And thank you for all the audience who have stayed with us until the very end. We have quite a good number. And thank you for joining us today. Thank you so much. Thank you, Dr. Lanre.
Thank you for the fantastic reception. Thank you very much.
Thank you, Dr.